Oh, Chevy Chase in Vacation, a classic moment with Christy Brinkley. Okay, so here's the question for you now. We're very relaxed today.
Yes.
Can the power of fantasy improve your relationship? The result of a new research study might actually surprise you.
Now, this is a conversation that we might want to say, hey, if you got the little ones, you might want to move them out of the room just for a second.
Just for a second.
Just for a second. Personality profile, Dr. Richard Levak. Always nice to have you with us. Good morning to you. First things first, we got to ask the question, do most people have sexual fantasies?
I'll take this one. The answer is yes.
Go
ahead, doctor.
Yes, 90 to 98% have occasional sexual fantasies.
Who are this 2%, by the way?
Yeah, who are the 2%? Yeah, they're sleeping. Yeah, yeah. Almost everybody has occasional sexual fantasies.
Okay, one of the things.
And there's nothing wrong with that.
Of course, there's nothing. It's perfectly natural and normal. Do men and women have different types of fantasies? Because we've always learned that, of course, men and women think differently. We're wired differently. So how do our fantasies?
Chrissy and I were saying it's a fantasy for the men to take the trash out. You know.
Oh, that is a fantasy because it ain't going to happen. So is there a difference?
Very good. There is a difference.
Yeah.
Women's sexual fantasies tend to be more vague, romantic, about the mood, about the way that they are seduced, rather than specific sex acts. Men fantasize about specific sex acts, which I won't talk about on the morning news.
Thank you for that.
But they're very specific. They're not. Men don't dream about romance. No. They dream about specific.
Why is that? Is it still safe to say that it's because we're wired differently? Is that a simple enough excuse?
I think we're wired differently.
Yeah.
We are much more focused on visual cues. I mean, women generally, they can enjoy certain types of erotic movies as long as they're not too extreme, whereas more men enjoy that.
Okay. But what is the role that they play? Are these fantasies good, bad? Do they do something for our relationships?
It's a great question. A brand new study, it's not yet been published, but it's been discussed. 3 new studies that show that if you fantasize about your partner, for the next 2-3 days, you are warmer to them, more loving, feel more committed. Researchers took 3 groups and told them to fantasize about solving a problem with their wife, having a sexual fantasy about someone else, or having a sexual fantasy about their wives. And then they monitored them for a couple of days. After being told to sexually fantasize about their partner, for the next couple of days, they were warmer, more loving, and the relationship improved, and their sex drive increased.
Wow. Interesting.
So the moral of the story is, if you are not getting along particularly, if you allow yourself to fantasize about your partner, it will draw you closer.
That's good advice for probably a lot of people. On the flip side, though, what if you're fantasizing about someone else? Is that kind of considered cheating, or can it lead to that?
The research has shown that it generally doesn't have to lead to actually cheating. If you are very focused on someone and you fantasize about them and you pursue them, that's dangerous. But if you occasionally have a vague fantasy about someone that aids you in enjoying your partner, that isn't bad, unless it makes you feel guilty. But fantasizing about your partner increases your bond and your sense of connection.
Because some people would probably think, well, what's the point of a fantasy? It's not a fantasy if it's your own partner, but it can be. And that's the key.
That's the key. And it brings you closer. In a sense, what you're doing is you're thinking about your partner, and in that process, when you see them, you feel better disposed towards them.
That's so interesting.
So all you women,
what a neat
just
study.
think about us men lots.
There you go. There you have it. I like it.
Thank you, doctor.